Let's begin by understanding what non-alcoholic fatty liver disease or NAFLD actually is. It refers to the buildup of fat in liver cells in people who consume little or no alcohol. Now, NAFLD is actually an umbrella term with two main types. First, we have simple steatosis. This means there is fat in the liver but no inflammation or liver cell damage. It's usually considered a milder form. The second type is called NASH, which stands for non-alcoholic steatohepatitis. In this case, there is not just fat but also inflammation and damage to liver cells. This is more serious because it can lead to scarring known as fibrosis and eventually progress to cirrhosis, liver failure, or even liver cancer in some patients. Non-alcoholic fatty liver disease is surprisingly common. It affects about 25 to 30% of the global population. And the numbers are still rising, mainly due to the growing rates of obesity, type 2 diabetes, and unhealthy lifestyles. It's especially common in adults who have metabolic syndrome, which include conditions like high blood pressure, high blood sugar, excess belly fat, and abnormal cholesterol levels. What's even more concerning is that NAFLD is now being seen more and more in children and teenagers, especially in those who are overweight or obese. This makes it a serious public health issue that's no longer limited to adults. The main causes are closely tied to modern lifestyle and metabolic health. These include obesity, type 2 diabetes, insulin resistance, and high cholesterol or high triglycerides. These conditions make the liver more likely to store fat and become inflamed. There are also other risk factors that increase the chance of developing NAFLD, such as polycystic ovarian syndrome or PCOS, sleep apnea, a sedentary lifestyle with little to no physical activity, and of course a poor diet, especially one high in sugar, refined carbs, and processed foods. The tricky things about non-alcoholic fatty liver disease is that it's often asymptomatic, meaning most people don't feel anything at all in the early stages. But when symptoms do appear, they can include fatigue or general sense of tiredness, mild discomfort or pain in the upper right side of the abdomen where the liver is located, and sometimes an enlarged liver, which may be felt during a physical exam. In more advanced cases, especially when the condition progresses to NASH, people may start to show signs of liver damage such as jaundice or swelling, but by that point the disease is already more serious. NAFLD progresses through four main stages, and understanding them is key to knowing how serious the condition can become. The first stage is called simple fatty liver or steatosis. At this point, fat builds up in the liver, but there is no inflammation or damage. Many people stay in this stage for years without symptoms. The next stage is NASH, which stands for non-alcoholic steatohepatitis. Here, fat is present along with inflammation and liver cell injury. This is when damage really begins and the risk of progression increases. If the inflammation continues, it can lead to fibrosis. The liver still functions, but it's under stress. Over time, extensive scarring can result in cirrhosis, the final stage. This is advanced liver damage where the liver becomes stiff, shrunken, and starts to lose its function. Cirrhosis can lead to liver failure or even liver cancer. The stages are hence steatosis, NASH, fibrosis, cirrhosis are the four stages. Let's now look at how non-alcoholic fatty liver disease is treated. First and most importantly, lifestyle changes. This is the main treatment. Losing about 7 to 10% of body weight can significantly reduce liver fat, inflammation, and even reverse some scarring. Regular exercise like 150 minutes per week of brisk walking or cycling is strongly recommended. And the best diet, a Mediterranean style diet, rich in fruits, vegetables, whole grains, and healthy fats, while avoiding sugar and refined carbohydrates. Next, medications. These are not for everyone, but may be used selectively in patients with confirmed NASH or advanced disease. Pioglitazone helps in people with NASH, especially if they have diabetes. Vitamin E is effective in non-diabetic patients with NASH. GLP-1 agonists like semaglutide help with weight loss and may reduce liver fat. And SGLT2 inhibitors used in diabetes also show promise for fatty liver. Third, managing comorbidities. It's essential to control conditions like diabetes, high cholesterol, and blood pressure. If needed, statins are safe in NAFLD and should not be avoided. Also remember, cardiovascular disease is the leading cause of death in people with NAFLD, so heart health is a top priority. For advanced cases, options include bariatric surgery, especially in patients with a BMI over 35 and NASH. And in cases of liver failure or liver cancer, a liver transplant may be necessary. And finally, some key tips. Avoid alcohol, even in small amounts. Stay away from liver toxic medications or supplements. And keep up with regular monitoring, including liver tests and possibly a fibroscan. Remember, NAFLD is treatable, especially in the early stages. The earlier you act, the better the outcome. Thank you so much for watching. If you found this video helpful, please subscribe, share and like for more content on health and wellness. And if you have any questions or want to suggest topics for future videos, feel free to leave a comment below. Take care and stay healthy.